Okay, good afternoon, everybody, and welcome to the fourth quarter 2017 Community Health Promotion Council. We'll go ahead and get started, make sure we're being respectful of everybody's time. Just a couple notes for housekeeping. For water, coffee, and tea, it's just in the back there in the hallway if you guys need it. And we've got our table in the back for resources that we're going to be talking about today. For the agenda, please everyone take a look. And sir, I'll just turn it right over to you for your opening remarks.
Hey, thanks. I don't know if this is working.
Whoops, go back here.
Can you all hear me okay? Hey, thanks for coming, like you had a choice. You know, I want to make sure that you get a choice, so we were voluntold, so I appreciate that. But this is really an important event. This is the second one I think that I've been able to participate in. I just want to preface what we're going to talk about all this today, so that you're thinking about it, because at the end we're going to have a different discussion. As I got the pre-brief yesterday, and the 60-second MP I've already rehearsed, or 60-second med I've already rehearsed this with, so they gave me some talking points, so I appreciate that. And a great team over there, so I appreciate it. As we looked at the pre-brief yesterday, you know, we said alcohol, because as you all recall, I was pretty fired up about alcohol and all the trends associated with accident, discipline, and issues raised by alcohol. But then I looked at the numbers, and the numbers said, I don't think, is that working? Can you hear me now? Any better?
Yeah. Yes, we can hear you now.
Oh, I'm being recorded? Did I sign a waiver for that? Okay.
When you signed up, sir.
So, you know, I looked at it, it said we are 1.6 soldiers per 1,000 per quarter that have an alcohol-related incident. That's the JBLM standard, or the JBLM stat. The Army's higher than us, or FORSCOM's higher than us. The McChord team's lower than that. And so I said, well, you know, what we need to do is come to a consensus on when we think that we got to quit worrying about alcohol, just sustain the momentum, understanding we're going to have those issues, the chain of command get involved, like we do for sexual assault, keep our touch points on it, but what do we really want to take this CHPIC to, and how do I help? So here's what I'm going to throw out to y'all. We're going to set a mark of 1.67 or whatever we decide, and if you break 1.67, then I'm going to start talking to you about alcohol. If we see a trend in sexual assaults, we'll continually talk about that. But at the end of this, if we go through all this alcohol-focused discussion, I'm going to ask you at the brigade level to tell me what your biggest CHPIC issue is for your brigade. So I'll give you an example. So, you know, at HH First Corps, I would say musculoskeletal injuries, because we're all old people, relatively speaking, are probably one of our significant issues. Probably not a lot of alcohol or drug or any of the rest of that. But I would say if the HHB commander came and said, hey, I probably, based on my population, I think my #1 issue is musculoskeletal injuries. Another brigade may say, well, you know, I've got an overweight issue, so I think overweight is something I want to focus on. So we're going to take what your priority is, and I'm not going to say we're going to have one big banner event. We're going to optimize this by brigade. And so when you know the brigade says it's overweight, I'm going to say, okay, so in your training management process, your scheme, if we're running a red, amber, green, I know you're not going to do it in green. You're going to have to tell me in the red and amber period when you want the power of the installation to prioritize you with all the capabilities you require to get after that problem. And you're going to put it on your training schedules, and we're going to run that by your training calendar. So that the installation and all these great folks that are doing all the hard, heavy lifting for our servicemen and women, they can go, okay, great, you're giving me the priority, you're giving me who I got to help, and giving me a time frame for that. What that forces me to do is resource you. That's what I should be doing anyway, instead of, you know, driving, are we going to go to 1.6 to 1.5? It's, hey, let commanders determine this is what I need, and here's when I need the help. Then the issue will be, okay, I got 6 brigades that all want the same thing. Okay, so how do I deconflict that based on their training? And if 2 wanted it one in the end of October and one at the beginning of November, we just say you're both going to get it. We'll split the middle, and this is when you're going to get it. So that's what I'm looking at doing, and that's what I want your input on at the end of this is, hey, does that make sense? Is that doable from your perspective? And if the answer to that is yes, then I'm going to slap the table, and the next CHPIC, you're going to brief me on what your requirements are, what your training window is to get that done, and the intent would be before that briefing's done, that information's already gone through and it's all been racked and stacked by the folks so that they can say, we've heard all that, here's how we would lay that out, and here's all the friction points, Valesky, and that's what you need to fix. Does everybody understand what I want to get after? Does that make sense? Okay. Those are my opening comments, ma'am. Thank you very much.
Oh, no, thank you. Okay, sir, so what we'll move on to next is we want to recognize a few folks as our resiliency heroes. So we'll go ahead and bring them up here to the front, and they're going to give a short presentation on what they've done. And if we can wait until the answer, and we'll have you come up after they've talked about it. So first, we'll go ahead with Sarn Hopkins.
Do me a favor, will you? You look great as a screen.
We're going to turn off the screen.
Can you come up this way? Keep coming, keep coming. There we go. Now you're looking great.
Sir, my name is Major McGrain. I'm the Triple Nichols Brigade Surgeon, and it's my privilege to recognize Sergeant Tasha Hopkins, our Behavioral Health NCOIC, as our resiliency hero. She has done a lot for our brigade for resiliency. She has been instrumental in combining the Willing and Able yoga program with MRT, which not only taught new stress reduction techniques to the soldier, but also enabled us to meet the commander's goal of monthly MRT training. She's also been involved in teaching hundreds of soldiers the red flags of suicide and suicidal ideation, which is enabling the readiness of the units and protecting their health as well. She also recognized the need for an SOP for suicide awareness within the brigade and wrote that herself and was able to implement that. She's done a lot of work with our recent exercise for DSURF in managing resiliency at the disaster scene, and is also involved with multiple other units in ensuring their resiliency as well.
Yeah, I'm not getting away. I'm sorry. I'm too impatient. So she's pretty good?
Yes, sir.
Done pretty well?
Yes, sir, absolutely.
Give a round of applause. These are the first soldiers before so you're like the first one. Congratulations. All right, well done. Okay, who's next?
Sir, good afternoon. Good afternoon, everyone. I have the privilege of introducing a leader who in his 2 short years in the group has managed to impact an organization consisting of over 600 personnel. Sergeant Priest was a nomination for the 6th Military Police Group CID and was the first behavioral health specialist ever assigned to the group. Without an OIC and social worker to help guide him, he was single-handedly responsible for providing resiliency support to special agents in an area of operations that spanned all 22 states west of the Mississippi, to include Korea and Japan. In the 2 years that Sergeant Priest has worked in the group, he has traveled over 87,000 miles and executed over 350 hours of resiliency training to provide his service and be there for when our agents needed him the most. Our special agents have the tough job of dealing with the worst of the Army on a daily basis, and it takes a special kind of someone to crack the code and be able to develop rapport and trust in a group that is very close hold. Sergeant Priest is that special someone whose character and competence taught law enforcement professionals with different ways of dealing with stressors of the job. His innovative training method promotes self-awareness, training to real-life scenarios and real-world application to ensure soldiers are best equipped to deal with stressors faced when executing law enforcement duties. In an organization whose culture inherently rejects it, Sergeant Priest created a positive perception of seeking help and also a framework for soldiers to help soldiers. Sergeant Priest's contributions to the group leaves an exceptional legacy that sets the bar high for future behavioral health specialists within the group. He was recently accepted into the AMED Behavioral Health Officer Program and actually leaves for Fort Sam Houston next week after some much-deserved leave as well. I can't think of a better way to send this leader off, and I look forward to seeing him back here next time as Lieutenant Priest. I want to thank First Corps for his selection to receive this recognition. Thank you, General Valesky, for taking the time to recognize this outstanding leader. America's Corps, thank you.
All right. Sir, everyone, what a joy. Chaplain Wade Shepard with the 508th Military Police Detention Battalion. And for those of you that don't know, we care for the Northwest Joint Regional Correctional Facility. And Specialist Creo and I have been working together for a little over 2 years now, and she's the epitome of resiliency in my mind, not only as a soldier, but also as a single mom. So say a couple of things. One, she's helped with over 30 resiliency days, which at us in the corrections environment, dealing with corrections fatigue, that is oxygen in the air, an environment where we breathe poison. So she's been absolutely essential in those particular days, from cooking to planning to executing hikes to coordinating master resiliency training and interdisciplinary work. Then in terms of a personal life, single mom with 2 children, beautiful Lizzie and Elena, 4 and 1, and exemplifies in terms of being on time, in the right uniform, at the right place. She exemplifies it over and over and over, and it's my honor to be here today. All right.
Good afternoon, everyone. I'm Colonel Tammy Pettit, the R2 Director for First Corps. Today's topics for the 4th Quarter Community Health Promotion Council will center around alcohol and responsible drinking. We'll show the effects alcohol has on health and readiness and the impact seen in compounding negative actions such as sexual assaults, domestic violence, and suicides. No bad action ever gets better by introducing alcohol. We will discuss the current policies and whether they help or hinder efforts. And we have some best practices and initiatives that will be briefed by the GSB 1st Special Forces Group and HHB from Fires Brigade and 62nd Air Wing. We highly encourage good open dialogue to find out how units are dealing with the potential for alcohol misuse. Next slide. Go through these rather quickly. We've done a lot of work since the last council to get after the do-outs that lingered from past councils and new ones that were identified. For the MERC Go, the Army standard, as we know, is 85%. The First Corps standard is 88%, and the stretch goal for First Corps is 90%. We are going to close that out, sir.
Okay, well, we were going to close it out after we talked to the commanders. We said, I think last time we said we were at 85%. How are we going to get better than that? The stretch goal, which I'd never heard that term before, it said stretch standard to begin with. So they explained it to me that it was something that we're looking to achieve, but would be almost impossible to do so. I was like, okay, then let's call it a stretch goal. But what should the standard be? So we're throwing out 88%, and I want you to know there was a lot of scientific discussion yesterday about that. We said 80, 85, 90, about 88% sounds right. That's the level of scientific analysis we did. So we throw that out there for the commanders to say, okay, let me see if we can do that or not. So next CHIPIC, I want to leave this one up here and say, so what do we think? Give us an assessment to say, is 88% something we can achieve? Or is that something you got to come back and tell me, hey, I don't think so. I believe we can do better than 85%. I'm told that getting to 90 is, if we did nothing else, is about how we would do that. So I don't want to be draconian in that way, but I do want to get farther forward of the standard than we are right now. So for the commanders, that's why 88's out there. So I'd like your feedback as a due out next CHIPIC. Okay?
Hello, sir. All right, the next one is the MedSafe containers and envelopes. An additional container is on its way for the McChord Clinic, and envelopes are in plenty supply. This due out is recommended for closure unless we have any additional questions or concern. And Colonel Mike Place is on tap to answer any of your questions or concerns.
Are they being used?
Yes, sir, in small numbers.
Okay.
If you're talking specifically about the mail envelopes, relatively few of those are being used. The blue box at Madigan actually gets a lot of use and then declining significantly thereafter.
Well, the reason I ask is because as I was coming back from Australia, there was a CCAR saying they found atropine injectors in a dumpster. And I was like, okay, well, wait a minute. We've got a med-safe container program. How did that happen? I haven't gotten the readout of what the forensics of that led to, but I just want to make sure that people understand that there is an alternative than throwing things like that in the dumpster, especially because I think, if my memory serves me properly, the reason we found out about it is because some kids pulled them out of the dumpster. That's problematic for them. So children and stuff like that. So I want you to make sure that people know that there are capabilities to do that.
Both 7th ID and 593rd have well laid out programs for their special population PT incorporating medical professionals and ability group, and I'm confident I know other tenant units, Special Forces, Rangers do as well, our Air Force partners. We recommend closing this due out as well. If there's any additional discussion or recommendation, I know we had some highlighted programs. 17th Fires has a great program that General Stammer attended. Sir, I think this one is wired, and I think the CSMs can attest to that. And sir, the last one is the Special Forces and Rangers. We'll be requesting a brief on their third program, or the Special Forces R2 POTIF. I don't know if that's how they say it, but it's the R2 and Preservation of the Force and Families program. It's their R2 program that they have, and we'll be asking them to speak on that at the first quarter, Chipsy, next quarter. Cool. All right, next slide. I'll be followed by Colonel Nicole Lucas, the Joint Base Commander.
Good afternoon. I am Colonel Lucas, the Joint Base Commander, new Joint Base Commander, so glad to be here at my first JBLM Chipsy. So my job here today is to introduce our topic of discussion, which is alcohol misuse, health, and readiness. And here you can see on this slide, to get us started, we took a look at the JBLM risk reduction data. And what that data shows us, as you take a look at this chart, is that the JBLM average rate for alcohol offenses is steadily trending downward, or looks to be trending downward, and it is below Army and FORSCOM averages. This is not to say that we don't still have issues in certain units or across the installation, but in those cases our embedded risk prevention teams are able to work directly with command teams to get after those underlying issues in a collaborative way, to take a look at those incidents and then those other risk factors that are associated with alcohol use. So although these trends here appear positive, we dug into JBLM high-risk behavior, and if you go to the next slide, this is kind of to determine the level and the role of alcohol in these other high-risk incidents with alcohol involvement. So, and I'm going to hand this off to Major to start us off with the SHARP and sexual assault data.
As our Joint Base Garrison Commander said, that we see the involvement of alcohol, but this is not the same slide I saw yesterday. As we look at these slides, what do we say that the rate is for? Go back a slide. Okay, that's not what I saw yesterday. I saw the JBLM rate. Where is that slide that we saw with all of the brigades that were broken down by? Okay, so go to that slide really quickly. Okay, so that's the slide I'm looking at. 1.67, and those are the brigades the alcohol incidents fourth quarter to third quarter 17. So I want to make, this is my concern as we talked about this yesterday. So go back to the slide we just talked about. Maybe I'm misreading the slide on what the JBLM percentage was. Go back, was there a slide before that one? Yeah, so what that says RRP 1.89, I think, and then the RRP FORSCOM rate 2 point, whatever that is. Why are those numbers different? Are we measuring two different things?
Sir, so the number we're looking at here, sir, is the average for just one quarter, for third quarter FY17. And it's a moving target based on the number of offenses. And so when you're looking at the other slide, sir, that was an average for 4 quarters. And that's why you see a difference in the numbers.
Yeah, okay, so this slide's not helpful to me then. I mean, what I want to do then is, this is a monthly slide, or is this a quarterly slide that you're showing me?
This is showing one, well, so the data on the graph, sir, is going back to 2014.
No, I
and
got that.
The blue
But
box.
this slide says April to June, so it's a 1-quarter slide.
Yes, sir. That blue box is showing the last quarter of information.
Okay. Okay, but so we said we have an uptick from December. Are we on this is the question we had yesterday. The line that shows our median says we're going down, but we were talking about an uptick over the last 2 quarters. Is that trend line still going down, or is that trend line flattening out? That was the question we had yesterday. Do we know the answer to that?
We will when we have next quarter's numbers.
Okay, so if I just did a trend line from December 15 to January 17, what would that trend line look like?
You would see a different trend line that probably looked a little more flat. Yep, and with a slight incline. Yes, sir.
So, we gotta snapshot, snap the chalk line at one point and say, okay, because conditions are different in 15 than they are in 17, right?
Oh, yes.
So, the reason I'm fired up about graphs is when we looked at explosions and casualties in Iraq, you could see trends, but then you'd say, well, wait a minute, it changed here, the conditions changed. So I want to make sure that while we're showing a long trend line, that we are snapping a chalk line saying, but here's what's different about this. And when we see spikes from 15 to 17 like that, what does that mean and why? Do we know why we have seen an uptick or a flatter line 15 to 17 than we did 14 to 15, just because it's a longer period? What do we think?
Sir, I'm going to have to defer to our prevention team to give you a little bit better answer on the mission analysis.
Because, I mean, this is the crux of the problem. Are we making progress or not?
Right.
Is this just cyclic? Because as Nicole's talking about, how much effort do we need to continue to focus on this as a primary, risk versus saying,
Right.
okay, we're just in a wave of, we have a peak, we have a valley, what's the trend going to tell us? So you're telling me I got to wait till next quarter, you think, to really determine that?
No, we can show you. No, absolutely not, sir. We could draw the line starting from 2015, and we could look at it there, and we might have a different trend line, absolutely.
But I want to make sure the JBLM rate is 1.89 per 1,000 in this quarter.
For this quarter, yes, sir.
So that means 2 soldiers per 1,000, one time every 3 months are going to come into that, right?
Absolutely, sir.
So
You
what's
have
the
it.
total numbers based on our population that 1.89 is? What number of soldiers is that?
The actual incidents, sir, were 49 incidents, yes,
And
sir.
how many people do we have at JBLM?
Ooh,
Because that's what we're measuring, right?
right. For this number, sir, we're probably looking at approximately 30,000 from the database. That was the poll.
So what I want to get after is, how do I communicate to the Army to say, because the Army is doing the big piece as well. I want to drive the Army to say, this is JBLM's #1 issue based on what my brigades say. So I want the Army to come help me solve some of my problems and increase resources to what I need. And what I want to be able to do is show them on these high-risk data or trends, rather, like sexual assault, like alcohol, like tobacco, whatever we're saying. Say, here's where we're at. You're seeing it within a band of excellence, and we won't say risk is ever excellent, but this is what we're going to realistically get to. And you need to be concerned if it goes above here. That's when I get concerned. Other than that, let us figure out how to do that, but here's where I really need your help. Are we communicating that way to FORCECOM, MCOM, and the rest?
Yes, sir.
We are.
Yes.
So what is JBLM's #1 risk to the force in CHPIC? What's our #1 risk? Is it alcohol? Is it obesity? Is it musculoskeletal? What are we telling FORCECOM and MCOM?
To be honest, sir, this is a lot of bottom-up driven information, and that is why we have those the dimensions of the working groups that feed into the Installation Prevention Board,
Okay.
which feed into here. This maybe made the top 4, to be honest, for risks.
And who determines what we communicate there? Because I don't think I've ever written General Abrams or, Miss, whoever the new MCOM command, the 2 lieutenant generals, Gwen and Ken Dahl. I don't think I've ever written them and told them this is the #1 risk to force from a CHIPIC environment that came out that I want us to focus on. So who's communicating that?
Well, we will. Going from here forward, sir, yes, that's what this
Well, I mean,
forum
but
is
this,
for.
if I'm going to tell the brigade commanders and division commanders, I want your #1 issue,
Yep,
and I want to prioritize that, I'm going to have to tell them I'm going to need some help.
yep.
I just know that. But if I'm just doing this in the aggregate, and alcohol is the venue we're using today, I'm not sure that's as precise enough that FORSCOM and MCOM need to know. So that's what we need to drive. So when you say this is bottom fed, okay, this is the top 4. I don't recall ever seeing the top 4 that we've sent to outside our headquarters. And as the senior commander here, that's what I should be putting my signature on.
Yes, sir.
Okay?
You're not wrong, sir, and that's exactly where we're shaping this to go.
Okay.
Yes.
But commanders, what do you think? You guys have sit in these over and over. I mean, what is your assessment? Yeah.
Major and I, as we look at the NTT deployability. Sorry, Colonel Maselli from the Lancer BCT. As Sergeant Major Graves and I look at the deployability numbers for NTC, we see a significant order of magnitude much larger than this for physical readiness and specifically musculoskeletal issues. We have on the order, and Sergeant Major's checking the per stat, about 400 medically non-deployable soldiers right now. And as we pull everybody forward we can in the National Training Center, at least 3% of our formation is going to be staying behind, approximately 200 to 300 soldiers because of medical readiness. And then we believe the subset is musculoskeletal injuries, and we will work the hard data for that before the next council.
Okay. I just want to be able to communicate on behalf of JBLM, as well as Army and Air Force, because if the Air Force has got an issue, I want to be their advocate as well, across service, to say, these are our priorities, and this is where we need help. Tammy.
Sir, our next opportunity is on 16 October with the FORSCOM CR2C, which is their version of the CHIPSI, and we will be identifying our top issues to the FORSCOM commander, sir.
Right, but when do I see those?
Oh, well,
That's my point.
we'll build that. We will build
I
that.
can't wait to see it, Tammy.
Yes, sir. Yes, sir.
So then what I just heard you say is, when's our next CHIPIC?
Ours is in October.
Yeah,
we're
when?
looking at 18 October, sir.
I'm sorry?
18 October.
And when's the FORSCOM one?
16 October.
Yeah, ours will be before that.
All right.
Because I want to show what we're going to brief to FORSCOM, to all the commanders here.
Cool.
And I want them to say, that's not what we think it is, okay?
All right, sir.
So let's figure out how we're going to do that. If I got to do it from Korea, BTC, I'll figure out how to do it from Korea,
All right, sir.
okay? All right, go ahead, Nicole. Now that I've completely, screwed you over on your briefing, I apologize. Go
Sir, I
ahead.
think we'll go back to the next slide. I'm going to hand it over actually to Major.
Good afternoon, ladies and gentlemen. For sexual assaults, in context, this is 144 total cases this year. 62 of them have involved alcohol. We are, that year-to-date in 16 is 47. Currently, year-to-date, 16 to 17 comparables is 44% to 43%. So
I didn't hear that. So how many did we have last year that were, or in the similar last reporting period, that were alcohol-related?
last year was 163, and 70 of them were involved alcohol last year, sir. So the difference is 1%, but in total numbers, about 8 victims had alcohol involved with their assault.
Okay. But again, what's the so what of what we're getting after?
Sir, as we've been trying to put ourselves and compare ourselves, so one of the biggest non-reporting reasons is that collateral misconduct that victims feel. So I did a comparison poll from USER where the alcohol age is less. So looking at their numbers, they are actually sitting at 62% of their sexual assaults involve alcohol. So an assumption that we're trying to prove is, and make fact, is the fact that if there's continual prosecution of collateral misconduct, victims will not identify that there was alcohol involved with the sexual assault.
But are they saying they were sexually assaulted and just leaving out the alcohol part?
Yes, sir.
So the reporting, they're still reporting.
Yes, sir.
They're just not saying they were alcohol related.
Correct, sir. So to truly understand our operational environment, we're missing a variable. And so if we can get our victim advocates to, at least let the victim understand some of those circumstances, as well as through our first sergeant commander scores, part of my briefing to them is that they know that they have the ability to defer until after the investigation is complete, and even on beyond that, for the victim to come forward and say, here's all of the variables that happened, or where I was, what I was doing, what was being done.
So for the commanders, I'm interested to hear your thoughts on where we need to focus our dialogue on these issues. I believe that battalion commanders and their command sergeant majors get it. I know brigade commanders get it. I know division commanders get it. Where do we think we need to focus on, coaching, mentoring, and teaching? And then how are you getting after doing that? Because I would say if I threw out, and I'll just use the Air Force as an example. Yesterday when we were talking about alcohol, I think they said they had five incidents the entire quarter. And I'm thinking, wow, that's pretty awesome. How did y'all do that? And so as I look at what are they doing that we could leverage in the Army? What systems do they have? My worry is, we're a lot bigger, and if leadership matters, what are we doing to get after that leadership level that we need to? Where do you think it is? Do you think we got to coach battalion commanders and their command sergeant majors? Do you think we got to go down to field grades? Where is it? Really, anybody. It's not a trick question. Where? Where do you think it is? There we go. Go ahead. Go ahead. Go ahead, Todd, and then you're next, okay? Go ahead.
Yeah, Todd Berry from the 201st. So one thing we're doing is Sergeant Major started a junior enlisted council and a senior enlisted council. We're looking for the informal leaders, the influencers at the junior level. So, we work at the command teams all the time. And our assessment is they get it. And the leaders get it. But it's the informal leaders and influencers within the units, the junior soldiers that everybody turns to as that soldier that they turn to for answers. We want those folks to have the information and help influence the population, just as we as leaders and first sergeants, company commanders, sergeants major, just as we do. But we need those informal leaders, and that's what we're working on with our junior enlisted councils.
Okay, they're behind you.
Yes, sir, completely concur with that. The influencers at the unit level, that's critical, as well as, down at the individual, who is my direct supervisor and what are they actually saying? Whether that's the squad leader or all the way down to the platoon leader, we've got to influence that. One of the things we're trying to do to attack the problem from the other direction is we've got a first termers academy. We've kind of mentioned this with some of the other peers within the division. So all the soldiers that are new to the brigade, as well as those, or particularly those that are new to the Army, as well as those coming from Korea, where Korea was our first duty station. We bring those in and we spend an entire 2 days with them, making sure that they understand a lot of these risk factors and understand where they can go for help, and encouraging them to understand some of those influencers that they're going to soon not fear, but feel within their units once they get there. So we've had a lot of success with that with the First Termers Academy, and it's, again, something we've shared with everybody else.
Sir, I think for us, or at least one of the resources that I'm relying on to do this is what the risk prevention specialists are coming and briefing me on. I think one of the first things that I saw in it It's not uniform across the formation. So and I've got a couple different subordinate formations that I've got to take a different approach to, a different level of leadership that we're going to have to engage on, because they're at least in the data that I'm able to look at, how I can see ourselves at the unit level. Well, we're going to have to get a much lower echelon of leader in certain formations that below us, and maybe that's a problem unique to Jay and myself, is from the larger organizations. But it's going to have to be a little bit tailored down the road. Having that resource, though, of having that data available is really what helps me shape the plan as I go forward. And I'm not so sure. I mean, we're going to, we look at the alcohol numbers. We're leading the pack on that. I think it's actually worse than what we're showing in the data. So how do we get more accurate data to where we can kind of continue to say that's where we need to focus, that's the level of leadership at the particular echelon that I need to go down to try to go after it, to attack the culture at that level.
Okay. Anybody else?
Sir, the thing that everybody's talking about from the Air Force perspective is called the Green Dot program. And one thing that it does that's a little bit different, we tend to talk a lot about education and making people aware of risk factors, but we don't give them what are you actually going to do. And that's one of the things that the Green Dot program does, is has you identify what you're going to do and practice those behaviors so that when you end up in that situation that you actually have training that you fall back on, just like we all do, to make sure that you do the right thing when the time comes. I think that may be part of what we're seeing as a difference.
And sir, to dovetail with what Jasper was saying from the GHOST perspective, from Lancer's perspective, we're looking very precisely at not alcohol consumption, but irresponsible alcohol consumption, because there's an inflection point where one or two drinks become someone becoming intoxicated. And what we're seeing in our internal trend analysis is that it's the intoxicated individual who's doing these acts of significant indiscipline. And Sergeant Major's revising our policy for barracks access and alcohol in the barracks to minimize the number of intoxicated individuals, identify them early, and remove them from the situation.
Okay. Anybody else?
Sir, again, just coming into the brigade, so just getting the initial analysis, first look, so looking at 60 days. But this last month, we just had the SARB. That was the one that DCG ended up chairing, but we saw that of 8 new cases, 7 of them were from first-termers, E1 to E4, young, that population. And so that's your most vulnerable population, is that first-termers. So we're trying to look at that as, again, that newcomers briefing, that indoctrination, kind of like what was Triple Nickel behind me that was saying that piece, is how do you teach that population and mentor and coach. To dovetail off of that, one of the sergeant majors in the brigade came up with this mentorship program, female mentorship program for those first termers, to kind of pull them in and say, hey, these are some threats and things that you need to be aware of because this is a likely case. Again, alcohol in this case, it says it was, I think they said it's 50% involved, 50% not involved. I think it's got more to do with that junior populations. We're trying to see if we can correlate that as well to see if there's other incidents that we have. Is it just because they're junior and they just don't have that experience level and they need some mentorship along the way to help them out? Closer.
Any sergeant majors have anything to add? Since we've drug you in here too. Okay.
Sure. Family violence.
Thank you very much.
Good afternoon, sir. Jolie Darnell. I'm from the Substance Abuse Prevention team. And Colonel Holcomb is from Behavioral Health. And we're going to talk a little bit about family violence, suicide attempts, and suicide deaths. The data comes all from the clinical side, but there are a couple things that we want to make sure we're cognizant of. In child abuse cases, a lot of times they get reported by the schools or by the medical community or other folks, and so we don't always know if alcohol is involved in all the child abuse cases the way we do oftentimes with domestic violence cases, where the MPs have been called out and it's clearly in the police report that one or both personnel had been drinking. So there's a lot of issues that we have to take a look at when we say alcohol was only involved in 37% of those cases. It may be higher, we just don't know, and we don't have a way to track that. Anything you want to add to that? Suicide attempts, 33% of the cases involved alcohol. Again, we only know that if they show up in the ER, or if they show up on 5 North, or if they show up intoxicated on duty. So we suspect that the numbers might be higher, but we don't have a way to get at that. And same thing with suicide deaths. Even toxicology reports won't always tell you based on how soon the reports come in. Anything that you want to add to that?
Yeah, yes, sir. With regard to the suicide deaths for the FY17 year to date, you note it says 25% there. I just want to say we are still waiting for 4 toxicology reports to come in out of those 8. So we'll see what comes in out of those. But for that 25%, we know 2 out of the 8 in terms of the toxicology reports for the suicide death did indeed have some alcohol involvement.
And it goes back to what Colonel Pettit was saying earlier, that there's nothing that if you add alcohol to it, it gets better.
Okay, great.
Any questions?
Thank you.
Hi, sir. I'm Major Ayers. I'm the installation provost marshal. I'm here to brief you guys a little bit on the DUI statistics here on the installation as a whole, as an aggregate, which also includes McChord and the Lewis side combined. I just want to point out here is that statistically overall in the past 3 years, we've actually been on a downward slope in terms of DUI rates here on installation. Our monthly average is about 17 a month. Just want to point out to the audience here that also includes your retirees, your family members, and your handful of civilians that take a wrong turn and end up at our access control points and get busted for being drunk.
Okay, hold on. So this incorporates, these are not just soldiers in uniform.
No, sir, it's everybody.
Yeah, that's not helpful for me. I was not aware of that yesterday when we talked about that. So I'd like you to break that out, because you say 17 per month, but that's not 17 soldiers per month necessarily. That's 17 people, right?
Yes, sir.
So how many what's our average for in uniform DUIs per month?
That's something I'm going to have to take back with the calculator, sir, and break it out for you.
All right. That's what I need to know. Okay? Yep.
So that number would be rolled up into the next bar chart on the bottom. So statistically, we're about 4 per 1,000 for DUIs. That includes the aggregate number from off installation.
Is it per month, per quarter, what?
That's just overall statistically, sir. So out of, if we compare ourselves with the Washington State aggregate of about 7 million people, which would be rolled up into that number and break it down, we're actually on glide path to actually match the state DUI rate, about 4 per 1,000. So what I take that to mean is that we don't necessarily have the level of discipline within our ranks to perform a little bit higher than our civilian counterparts outside the gates.
Our civilian counterparts out the gates aren't dealing with what we're dealing with either.
That's true, sir.
That's not an excuse or a free pass. But is that over the year, or is that, because it says FY17 through 30 June. So I'm trying to get in my own mind.
So that's all 2017, yes, sir. So October 16 through June of 17.
Yeah, so is it 4 per 1,000 in 9 months, or is it 4 per 1,000 every month?
It's for that entire duration time period, sir.
Okay.
So the 9 months.
Okay, I got it. Go ahead.
That's all I have for DUIs. Pending questions from the audience.
I would just say, when's the last time the Army talked to us about DUIs? Anybody know? When's the last time the Air Force talked to airmen about DUIs? But I mean, from the secretary level.
It hasn't been.
Hasn't been.
Suicide has.
And this is what we talked about yesterday. Because the Army believes they've got a system in place that's going to punish you for a DUI. Your career's over. And that has been, but we still have DUIs every month.
Yes, sir. Every weekend I get the opportunity to review them. And it's it's not like they have really, they're just over 0.08. They're blowing like 0.235, 0.141. They're really drunk.
My point's being that the Army doesn't talk about DUI. When I was in the Army before many of you were born, we were drinking beers at lunchtime. I mean, 2 beer lunch, beer room or beer machines in your day rooms. Alcohol was glamorized, going to clubs all the time. Then we flipped the switch and DUIs were going and people were getting thrown out. We talked DUIs all the time because we were throwing people out of the Army left and right. But the Army put in a process now. You get a DUI, you get a GOMAR, and you're going to leave the Army. So the Army believes that they've got the DUI piece. We focus on holistic alcohol consumption, but we don't talk about DUIs. So how many of these acts of misconduct based on whatever risk that we have, can we put a system in that we say it's self-correcting? Because that's what I think DUIs are. They're self-correcting. And people see the punishment associated with it, and that has a deterrent effect. Where previously when I came in, if you were a lieutenant with a DUI, it was no big deal. So how do we get these other acts of indiscipline into a system that is self-correcting? And that's really what I'm trying to drive us to in some of these activities we see in these percentages. At what point do we say, okay, that we're going to just be able to maintain that? That's about as good as we're going to get. We'll go up a little bit, down a little bit, but that's kind of an acceptable, if you will, rate that we could focus on something more important. That's really what I want to get after as we started this conversation about alcohol, is what is that rate that we say, okay, once you penetrate that, then we're going to get excited about it again and figure out why you've got an issue with it, what's unique about that, versus, okay, we've got a system in place and it's self-correcting. That's what I need your help to see. Because we'll have the same discussion on musculoskeletal injuries. That's the soup du jour today, just like DUIs and sexual assault was 3 years ago. So what I want to do is the brigades come up and say, my number one problem is this. Okay, so what process are we going to put into place that enables it to be self-correcting and get you to a level that we think is acceptable, that you've got a system in place that now we can shift your focus to something else? Because what I can't afford to do is have a brigade that says, okay, I need this for 6 months. Okay, and then they're off at 2 months, and now I need it for 6 more months. How do we put a system as approach into this, if possible? Okay, go ahead.
All right, be followed by Colonel Pennant.
Thank you very much. Any questions? Okay.
All right, so I think what we're hearing is exactly what we're going to get at when we start talking about recommendations to kind of get towards a band of excellence for some of these risk factors. And that's absolutely where we want to leave some discussion for the way ahead as we started yesterday. So we'll kind of kick off the policies here with Sergeant Major Merle Ryan to talk a little bit about basically any issues or any concerns that we're seeing as far as the new barracks and alcohol policy. Sergeant Major.
Sir, I'm going to defer the policy discussion to the senior CSMs and the brigade CSMs in the room, but what I will speak on is what are we doing as your garrison and as for the brigades to help. So the first thing is the Sergeant Major of the Army has pushed out an initiative called That Guy. We've finally have received all the things that we need to receive, and so we'll start seeing that published here within a week, where we're using the That Guy propaganda to subliminally kind of implant the message of, hey, binge drinking is not okay. Even though you are drinking, you can drink responsibly and enjoy yourself. It has worked really well at the Warrior Zone, where I have actually seen specialists talk with their peers, specialists correct sergeants, hey brother, you've had enough, let's go. And so that tells me that it's working in the way that we want it to work, because now we're getting people to take care of their own before an event happens. With the BOSS program, better opportunities for single service members, there's an opportunity to participate in what we call life skill events, which is where we're teaching members to go out and do something instead of just go to the bar. For example, last week, we just had 8 soldiers go get scuba dive qualified, and that was on the MCOM G9's dime. So now we have soldiers who have I guess it went out. So now we have service members who have a reason to go out, have something to focus on. Hey, I'm going to go out, have fun, do this. We've done rock climbing, scuba diving, cooking, juicing to promote nutrition. So we have different focuses that we're trying to help our military communities focus on. We have morale trips, we have community service events, and we have competitions. Right now we have a couple of teams on the installation that are competing against other installations for boss bragging rights and for money to go back into our boss program. But in regards to community service, the last thing that we just did was the mobile Vietnam Memorial Wall, which is just here in DuPont. And that was our service members who were out there setting it up and just being a part of that. So that was for them personally rewarding, and they got a chance to go out and talk about what they were doing. And it gives them something to talk about other than, hey, I had 5 drinks last night, and that type of bragging. So we're trying to change the dynamic of the conversation and the dynamic of the focus of what they're going to be doing after hours on the weekdays and on the weekends. And then all of that together, somebody mentioned the sponsorship. There is just a tremendous support network to make sure sponsorship is working. And for those, because we have a lot of people coming in for basic training who got their orders last Tuesday and they're here on Friday. So there is no real opportunity for true sponsorship. They get one from the unit, and then within the boss program, they get brought into the team. So in that aspect, that's how we're supporting your soldiers, your airmen. And then I'll defer to the policy parts to the senior sergeants major.
Hey, sir, trustee me, I would say reference to policy. I have this policy is perfect to me because it is word for word exactly what we've operated on. And I know you just signed a new one a day or two ago, sir, so I think it's effective. I think where we don't do as good as we could is in our visit to off-post residents. I think across the Army, I think we need to do better in terms of getting in our off-post quarters or even our senior folks that live on post. And just, it's not that you're inspecting it, but I think we have a duty to know that people are living generally right. And, for our soldiers that live in the barracks, it's really about clean, safe, secure, functional, and livable. And, as I go out to BLC each month, generally, and I talk to all the Sergeant E5s in the basic leaders course, I do a little polling. You establish a rapport with them to let them know, hey, you're just there to understand. But really what I find each month, and this is across JBLM, is if I ask a group of about 150, how many first-line supervisors, young sergeants, visit your room one time per week? And sir, it's generally about 25%. And then I go, how about every 2 weeks? And maybe about the same. But on average, most of our soldiers are getting a leader knocking on the door prior to PT and looking for those things 1 or 2 times a month. And that's not all. We've got some that do it very, very well. But that's just not going to get us to where we need to be. That's not us owning our barracks. And I think we have an absolute duty, sir, to make sure that it's all those things, but mostly safe, and standards are being fully met. But, sir, we are a fan of the policy, 100%. And I just think it takes constant leader engagement, connected leadership to make sure that we are, our soldiers need to know that it is a privilege to live in the barracks, number one. It's not a right. and then they have a role in that as well from an accountability standpoint. But I'll defer to any of the brigade sergeant majors that might want to elaborate a little further. And I'll bring you the mic even. Oh, and then one other thing, sir, without the mic, that's okay. I just tell you, one thing that I don't know who said it first, but I heard it, and I know the CD is, we tried to frame it, sir, but I think we call our sponsorship, it's words, but words matter, world-class sponsorship. Because what Rich touched on, that matters. And you don't get that time back to set a standard and to set a tone when a young trooper comes into our installation here and wears our uniform that says Army or Air Force.
Sir, very brief. As far as the 593rd, we also agree with the First Corps' policy as far as the barracks. Just some things that we found out as we discussed the barracks policy across the 593rd was that something that we need to look very hard at is how we place our underage soldiers in rooms with soldiers that may be of age in the event that there is not enough space. So we just need to go across and look at that and identify those rooms where we do have to put underage soldiers in a room with a soldier that is of age so that we don't potentially have an issue just because we have an underage soldier in the room. But other than that, sir, we are right in line with the First Corps policy.
If you look at the policy and compare it to the one that was signed in this one, it's shorter because I took a lot of the things out that I believe are just leaders getting after it. And so if there's, if you're good with it, I'm good with it. Obviously, my sergeant major reviewed it before I signed it. I gave it another hack and took a lot of the stuff out that I thought was telling you how to be a leader. I expect you all know that. But if there's something in here that of any of these policies that inhibits your ability to get after this, please let me know. Because one, I don't like a lot of policy. I want to. That's why you see up there it said that I didn't reset it. Policy 19 on Army substance abuse was not re-signed because all it did was regurgitate an AR. I expect my command sergeant majors and leaders know what the AR is to reference. I don't need to have a policy regurgitating that. So if there's something in this policy that you don't like or you think is limiting, more importantly, just please let me or my SGA know. Any other questions before we move on? Comments, concerns, or heartaches?
I'll just share a comment and then steal your thunder, Sergeant. I think the importance of having a policy, sir, even, I know you don't want a whole lot of policies, but the policy is beneficial, maybe not for this group, but for the platoon leader, the platoon sergeant, the staff sergeant, the team leader, because it is the cliff notes. And we have a community, a mentality right now where they kind of look at the snapshot of it. And I know you want to get on it, so.
No, it's just a different way of saying it, Rich. Sir, only thing I would say is a lot of times, so our task force standards, our standards book, we printed 15,000 copies last year, and a lot of things changed. But I think a lot of times when we formulate those, especially when it comes to alcohol in barracks, because soldiers, the leaders will read the policy or the regulation and they'll get after it. But soldiers they won't do that oftentimes. But they will read a Corps or division standard book and it'll mean everything to them. So when they go to that, but sir, everything in this is perfect. This is exactly what we try to pull out of and put into our standards book because that gets down to the lowest level. But I concur, sir. I think there are many things we do not need policies and SOPs on because it's just our standard as we operate as an Army. But Rich, I don't know if I helped you or hurt there, but what I would encourage.
I think the Sergeant Major wanted me to put exams for every Army regulation. That's what I think he wanted, an exam book is how I read it. But here's what I would offer to you. Policies that we establish should be additive to fill a gap based on the conditions of the environment we operate in. That's why GO number 1 has been such a debatable policy when you deploy. Because do portions of GO1 fill gaps, prevent, things that we want to have So there's been a lot of dialogue on GO1s in this core about when you go on a Pacific Pathways, what's GO1 really mean? So I don't want to regurgitate an AR because I believe, how are you developing your subordinates? You develop your subordinates by showing them what right looks like, right? And that engagement of that. So how are we developing our junior non-commissioned officers? I mean, I can ask every command sergeant major to tell me what reg is which, and you'll be able to do it. Somebody taught you that, and there wasn't an eczema of every policy. But if, and the other reason I didn't re-sign number 19, it was about 89 pages long. I'm not going to have, this is the longest, tell me, is this the longest policy letter we have? Okay. And it's prescriptive in some regard. But Sergeant Major, I'll take your comment to heart. If there is a policy that you think we should have because there's an AR that's out there that's contradictory or is not very clear and it drives behavior, then I'm all about doing a policy for that, to add clarity. So if there's an AR out there that you say, wait a minute, this thing is, it doesn't make sense to you, then we'll put you tell me what the policy should be to help clarify the gaps in that AR. Does that make sense? I'm willing to do that. Okay? All right, any final shots before we move on? Okay?
All right, sir, so we've kind of talked about this slide. If there weren't any further questions or comments, we'll keep going. And we'll roll right into our talking about how the First Special Forces Group, sir, is getting after some of their data.
Okay, so we've got 55 minutes left. So I'm not trying to inhibit anything. If you've got questions, I'd ask us, and I'm talking to myself primarily, hold them till the end. But what I want to do is we've asked units to brief us, and I want to make sure they've got time to do that, okay? Yes, so go ahead, please.
Good afternoon, General. I'm Major Jason Pappas on the EXO for the Group Support Battalion. The current commander assumed command last summer. The chart displayed shows relevant URI results and reportable events for our unit before and after his assumption of command. The following are some of the actions we implemented to help mitigate unit risk. There are two main themes: proactive inclusion and team-based trust. Some of the assessments and tools that we use include the Enabler Integration Program, Unit Risk Inventory and Command Climate Surveys, and Profile Records and High-Risk Review. Conducted quarterly, the Enabler Integration Program is a 3-week program that allows us to receive, train, and assess new members of the unit and to establish a baseline for them to operate at the lowest level, which is our ODA teams. The content in the program ranges from standard Army tests, such as the APFT and weapons qualification, to jobs requirements, such as driver's training and pallet building, and also includes some soft-specific items, such as the grit psychological testing and wet silk training. Soldiers are trained and assessed by senior NCOs, and the program provides a foundation for success in the unit while allowing them to be indoctrinated into the culture. Each individual and their command teams are provided an initial assessment of the soldier and their strengths and weaknesses upon completion. Our profile record and high-risk review is a monthly event to discuss profile and high-risk soldiers amongst company and battalion leaders. The intent is to identify those soldiers who are at risk at feeling isolated from the formation and create a plan and devote resources to remedy that. We use the unit risk inventory to identify trends within a company. Those results shape the command climate survey to help commanders narrow their focus and prioritize efforts based on their specific formation. Taking the results from our assessments, we move to implementation. Company commanders have the ability to determine their focus areas with the freedom and trust to decide plans of action at the company level. The battalion is there solely to provide guidance and targeted resources specific to the issues and concerns that they identify. This continues to instill this culture of trust and team success that permeates the organization. As a support battalion, it is important our soldiers understand that we are not in competition with our line battalions. We are part of a team, and their success is our success. Some of the perceived outcomes that we have observed in our ability to foster an environment of trust that is team-focused and inclusive with clear expectations. We know that alcohol issues, specifically overindulgence, are normally driven by high stress and feelings of isolation, so we try to minimize that the best we can. While an organization built on trust serves numerous purposes and provides many benefits, it allows for leaders to affect soldiers' personal decisions, usually when those leaders are not present. Our soldiers want to continue to earn that trust and they don't want to fail their team, and so they make the correct decisions. That's all I have for you, sir, pending any questions.
Anybody have any questions? What resource requirements did this program necessitate? Were you able to do with what the resources you had? I mean, we talked, are these just things you've already done and you've just kind of optimized it, or did you require some level of increase in some capability or resource?
So the biggest increase of resources for the Enabler Integration Program, so we have a 4-to-1 student ratio for that program, so it's a very high intensive, requires a lot of manning on the NCO level, and so we usually keep the class sizes pretty small. But that's the biggest resource-driven requirement we have throughout our program.
And how many, if those are cadre, how many folks do you have dedicated to that?
So we have 2 members that are dedicated to that, and there's rotating through all the branches of service, SF, Signal, Logistics, cadre that rotate through to teach different areas and different specific, but there's 2 main that run the program.
Okay.
Thank you.
Hey, thanks a lot.
All right, so next you're going to hear from our HHB commander from 17 Fires, Captain Hoffman.
Sir, good afternoon. Captain Hoffman, HHB 194. My efforts in the battery or at the battery level are to change paradigms and outlooks on how we go about looking at alcohol, at drug abuse, at all the things that keep us up at night, sir. The HHB is an eclectic mix of MOSs, maturities, and experiences that contribute to an already healthy battery, sir. But we know that incidences don't happen in a vacuum, and my command team and I promote a climate where we empower the section NCOICs to be ambassadors for the rest of the battery. I feel that's a strong word and exactly what we need, the mindset that we need for the NCOs to carry out that outlook and provide, and then pass that ambassadorialship to the soldiers, that it's not just you see someone out there, you need to take charge. We encourage and engage that connected leadership and establish links strong enough to notice vulnerabilities in soldiers that may be losing that connection with the Army values, sir. Through these engagements, potential problems can be reduced or eliminated. My command team and I guide our ambassadors with the mantra that everyone at some point needs help, that you will not be looked down upon in any way for seeking help. And my ambassadors are encouraged to relate their experiences of their friends and families or they themselves to the soldiers. Pending your questions, sir, that's my technique. That's what I have for you, sir.
And you haven't had an alcohol-related incident since November?
Correct, sir.
Okay. So how do you, as you got new soldiers coming in, they're just part of this process, or how do you focus more effort? I mean, I've heard some from the commanders back there about some initiatives they've taken to bring newcomers in. I mean, how, do they just fall in, or do you provide any more, focus on them? What do you do?
Sir, so it starts at Waller Halter. Our sponsor takes a patch to them and greets them and welcomes them right there, right off the bat. Once they get to my battery, they're brought to my office. And we have a conversation with the first sergeant there. We have a conversation. It's more of a get to know you, where you're from, what are your goals, things like that, sir. Knowing that they have a support base right off the bat, that if they have any issues whatsoever, that we are there for them to help them in any way we can.
Okay. Any questions? Okay.
Thanks, sir.
Afternoon, General. Everyone. Okay, I'll use this thing. There we go. Colonel Murray from the 62nd Medical Squadron. Yeah, there are 2 60 seconds. If you look at the top left-hand corner, sir, you'll see the AFI 44121 that we're using prevention and treatment to ensure the readiness of our troops and minimize the consequences of substance abuse. with the understanding that we're not a one-mistake Air Force and we can return people to duty. That's what we're trying to aim at. In those circumstances that we can't, then we help them to transition them to civilian life. In the top right-hand corner, you'll see the statistics, sir. In 16, we had 95.5% return to duty, and in 17 so far, we've had 100%. Looking at the trends to see the scope of our problem, we have between 10 and 16% of people reporting behaviors that would be suggestive of a substance abuse disorder, and we have 4 out of 5 airmen that say that they know somebody that drinks underage. So that is a fairly large problem, and those statistics would suggest that maybe you're getting a little bit underreporting from the Army. Our job is to try and make sure that they get early intervention as early as possible, and we need command involvement to be able to do that. So what we're reaching out to the commanders through evidence-based alcohol intervention programs and walk-around programs that allow us to draw them in and to show them the importance of what we're doing and the importance of early intervention. You can see one of the metrics that we're using is airmen reported in the ARI. So they are referred to ADAPT. So ADAPT is our program for drug abuse and substance abuse. And they referred, and then we asked them, did you have other ARIs before this one that were not reported by the commander and the leadership team? And in 16, we had 29 of those, and 21 of those were diagnosed with a substance abuse disorder. And 17 so far, we're well below that at 5 with 3 diagnoses of substance abuse disorder. So the walk-around programs are working, and we're able to make an intervention and have the commanders report earlier and get them the help earlier, which is key. You'll see, sir, that the statistics for referrals on the bottom, currently we're not where we would like to be. So the red stripe, we want to be as big as possible. That has the greatest possibility of returning the airmen back to their duty and allowing them to continue to serve. The next largest one we'd like to see is the command referrals, so that we can see that there's commander engagement when their self-referral has not been opted for. And the last one that we want to be is the medical, the white stripe. We want that to be relatively small. We want to be the last ones who end up finding the folks. At-risk behaviors, we're seeing it in ARIs and substance abuse, substances used in suicide attempts. We're trending downward in our ARIs. And then the substance use in suicide attempts is smaller than it looks. That's 7 out of 8 since 2016, January 2016. So virtually all of them. In the suicides, in the deaths that we have had, not all of them were suicides. We've had 4. 2 of them were confirmed suicides. Both had alcohol in their system. Was it enough? Were they drunk at the time? No. But alcohol added to the situation doesn't make it better. 2 others that died that were not confirmed as suicides also had substances in their system. So virtually 100% of the people who have died had substances in their system that contributed to that event. Again, from those previous slides, I'd suggest that maybe those are being underreported in the Army. Any of your questions, sir? That's all I have.
Any questions? So I got a question for you.
So as I look at fourth quarter of 2016, there was a pretty substantial self-reporting band there.
Yes, sir.
So what was different about fourth quarter to first quarter, and maybe first quarter because the incidents went down, but as you look at almost near similar in the second quarter, why do you think you had such a good success in self-referrals fourth quarter and you haven't seen that since? What do you think what's your assessment?
I'd suggest that it's reactive. So we'll see a lag when lots of people self-reported and some people had negative consequences. That spreads. And then people are less likely to come forward because they see, oh, this person had negative consequence because of that. And then we have to overcome that again and show people they have the best success if you self-report. Some of the negative consequences, they can't be advertised because of HIPAA. Can't see what else is going on, so they had other substances in their system, but to everybody else it looks like, oh, well, they just drank too much and now they had this negative consequence, when in fact they did something that was going to have them leave the Air Force anyway because of other substance use, but that cannot be advertised. So the perception of negative consequences is usually what drives that lack of self-reporting.
Okay, that's great.
Yeah.
Pierce from Duarte. Just a quick question. First of all, I like your program. Prevention, I think, is the focus point for all of this, whether it's SHARP or alcohol, drug abuse. Can you explain quickly what the evidence-based alcohol education and treatment modules are and the evidence-based prevention strategies?
I'm looking in the audience for my subject matter experts. There we go.
Preventive measures are we doing? The education measures?
The evidence-based alcohol education and treatment modules and the evidence-based prevention strategies like the e-checkup.
So we have the e-checkup. We also do the values clarification. We do alcohol's basic education. We have like 5 different modules that we do with concerning alcohol, so we can break down to the service members what the relationship between alcohol and life. So what are your values? How is values playing a part when it comes to alcohol usage or even substance uses? Because yes, we're alcohol heavy, but there's a lot of substances that individuals are using, to include prescription medications and illicit drugs that aren't always popularized, but when they come through the clinic, we identify them, that people aren't tracking. And so we have the values clarification. We also, like I said, we do simple things like stress management, we do anger management. All that stuff plays into alcohol-related incidents and so forth. Does that answer your question?
So it does. Where can we find these modules at?
So we have a knowledge exchange that we get all of our information from. When it comes to the Air Force, we can easily send that out because it does help. A lot of the service members do find it helpful. It's small little packets, but it's on our Air Force knowledge exchange that comes through, obviously, the Air Force channels, but it's open information to anybody. We can send it to you.
Okay, thank you.
Your EDH should be able to tap into that anytime.
Doc, thanks for the brief. Just one piece that I'd like to point out from our mission perspective, the 100% return to fly status, which is a higher standard than just return to duty. So a lot of great work in the program to get people back up to that level in a timely manner and out executing the mission. So just a thank you on that, and I wanted to highlight that for any of the operational commanders that want to plug in on that. It's a great team over there. And then the second piece, just a follow-up. If we could go back to that fourth quarter data, and when we get back over at McChord, can you give me some more historical 15-14 on the fourth quarter? Because typically we have a lower ops tempo for a short amount of time over the holidays. There's more first sergeant intervention, and they're typically, what I had seen in the past, are more self-referrals where people are kind of guided in that direction, and also command-directed referrals based on alcohol-related incidents over the holidays. So that may actually be a trend of fourth quarter things that we need to be proactive in reaching out to get ahead of that. And thanks again, Doc.
Okay. Go ahead.
Ma'am, you just hit on it. Sir, I think there should be, when we have these timelines, there should be 2 overlays that should be always put on there. One is the op tempo, and one is the calendar of, hey, spring, summer, fall. So when we look at third quarter, we're talking April, May, June. Let's say around here, the sun motivates people. It does a positive thing. And then when we go back to, the rainy season, and it affects people. And as we look at that, we should be able to see what happened last year. We already have the data, and I know the team has got it. But that's something that we can use as predictive analysis and say, okay, well, we know we can expect trouble here. What are we going to do? How do we message some things? How do we get people out doing fun stuff, doing family-oriented stuff, doing something that's going to mean something to them other than let's go out and drink and have trouble and feel bad for ourselves?
So go back to the first slide we briefed. No, go all the way back to the first slide that was briefed. Okay. Now, that's a great slide. You're right. I need to be more. It's the one that talked about that one right there. Nope, you passed it. So
I don't disagree with the word you're saying. But that's what they've done. I mean, we're talking January through December, through January through December. But if you look at it through 14 all the way to 17, what I worry about is when we take too long of a snapshot. Because just looking at that one, you'd say, well, look at 14. Man, we went from 4 per 1,000 down to December of 15, down to, we cut it in over 50% in 2 years. That's a pretty good change of culture right there. But now, it's why I said, okay, so that's where I thought the trend line would stop, and we'd start to see it flatten out. Which I think if we do the snap the chalk line at 15 December 15 to January 17, over that year, I think you're going to see something. So I think your point's a valid one, but I would add on to that and say, why is it changing? And you could argue, well, at some point, you're just going to flat line. And you might have little increments, but you're going to be, people are people. Like DUIs. We're going to always have DUIs. We're always going to have acts of misconduct. We're a human organization. So when is that line going to flatten out? And do we accept that level? We don't want, we want zero, but we want to be realistic. Because getting to zero means I'm going to stop doing everything I do, and I'm going to focus on nothing but that. Well, I'm going to tell you what we're going to focus on. We're going to focus on going to North Korea and winning that fight. That's what I'm focused on. But if you tell me I want to get to 0 alcohol incidents, I'm not going to do anything else until I get to 0. So when does that line flatten? And do we think that's acceptable, that we have a system in place that is a deterrent, and if you do that activity, you're going to get held accountable and some consequences are going to happen. And once that thing starts to rise past that, we think that we had to focus on it again. So based on your comments, Sergeant Major, I'd say we got to look at the chalk line of December 15 to 17, January 17, say what is going on? Because you start looking up in January of 16, is that right? We had the highest level in a year of, we went back to 3. Well, why did we spike in that quarter? Because I think somebody did that because obviously it went back down, right? But now we're going back up. We have a trend line going back up. So what's different? So I am less concerned about showing me, Iraq IED explosions from 2004. What I really want to do is say, okay, here's a trend. Now I want to restart the trend. I want to start it at December of 15 and run it out through that way. And tell me before December of 15 what we were doing that worked and what changed. Because then when we do what the Sergeant Major said, start stretching out, we'll be informed. That's what I don't like about these graph charts, is it doesn't put anything into context. We did something on this installation in June of 15, and that got to December, that continued that to go down. We did something in June of 16 that was changing something that happened that got it back down to what I think, if you could shrink that a little bit. You guys are awesome, man. We did something there that changed the culture, that brought it back down to what I think is going to be that flat line band at about 1.5. That's where I think that flat band's going to show, 1.5 to 2.0, somewhere in there. So what do we do? And that's how we got to tie these graphs together. Does that make sense, Sergeant Major? Yes, sir. Okay, so that's the graphs we got to start building, because that tells you what the so what is. Okay? All right, any other comments on that? So go to where we were. Let's see how agile you are. You remember what slide we were on? Oh, pretty close.
Oh, we could be, yeah. We'll go back. In the interest of time, sir, we'll go ahead. We talked about this yesterday. These numbers haven't changed. Unless you have any questions about the ASAP inspection, they're moving forward to get after these numbers.
Okay.
Now to get over to the recommendations, sir, exactly what you've been talking about. Number one, that's right there. We owe that information to you. What is the segment we're willing to accept from that standard line? And so we'll get that to you, sir, and that's something that we'll work with the Joint Base through the installation prevention team.
Right, but I want to make sure that before I see it, all the commanders and their sergeant majors in this room see it. And if it's, 100% everybody agrees, I'll know where you haven't asked everybody. So I want to know what the dissenting views were of what we think that should be, okay? So when you bring it up to me, I got both sides of the story, okay?
Yes, sir. Number 2 was something we looked at with our data collection as far as making sure we were capturing all of the alcohol incidents. And so is that something that the PMO is going to take back and look at, sir?
Yeah, and it's, non-military. Now, here's the deal, though. I don't want you to throw the baby out with the bathwater here. I understand why you are collecting on adults and children, and we got to continue to do that because that's part of family readiness, right?
Yep.
Part of that readiness piece that we need. So I don't want to disregard what's going on in the family component of that. But we got to be clear that this is what the people I can affect directly are, and then how I have to look to shape to get after some other group that I don't have habeas gravis authority over, okay?
All right, sir, number 3, we're looking at making sure that our command teams are doing what they can to get their service members referred over to the treatment side when there is an incident with alcohol. So I know they're tracking that. Same thing with making sure that they're getting the education for the AR, what they need. And then lastly is what we can do to get after adjudicating service members faster to keep our recidivism rate down. Do you have any comments about that from the group, or ma'am, from you or sir?
I think we've reached our airspeed and altitude. We're losing airspeed and altitude pretty quickly.
I think we have. We're going to keep moving along. So it looks like from your guidance, sir, we'll go ahead and get our next meeting earlier than our Force Comp C or 2C. So what we're looking at for the timeline then will be pushed up a little bit.
Okay.
And I wanted to jump to closing comments, if that's all right, and kind of get after.
Anybody, what I wanted to do, I asked us to accelerate so we had time to talk about what you wanted to talk about. So if there's any comments about this, so if you got something else you want to talk about, we're ready. Yeah, Senate Chris.
I'm going to ask a new guy question, and I apologize for that, but having been out of the command track for a little bit, just wanted to see that I'm used to seeing, and I'm going to go back to sponsorship because that's one of the most critical things. That's when the soldier and the families are the most vulnerable, when all the stresses are placed upon them. They're moving, they have to find new house, new kids, not new kids, but they have to find school for kids. Hopefully they're not looking for kids. They've got to go, see, the room is okay, sir, they're awake. So they have to go, and all the stress is placed upon them. We used to get, in a different installation, the Connect the Dots report, and I don't know does that exist here or not, because that Connect the Dots report would be an email I would get that would say, hey, of the 15 soldiers you're going to get this month that are new soldiers, 4 of them meet the criteria for being high risk in a couple of areas. Either they've had a pattern of financial issues, a pattern of alcohol issues, a pattern of whatever. And this would go through the staff at the division. They would all check the files, and then by the time I'd get an email, I'd be able to go, okay, I got 15 guys, but these 4 folks, they may react to less able to have resiliency than others, and I have to give these folks better attention. Does that not exist at this installation?
Sure, I don't know if that does, but I'm happy to look into it. That feels like something that through the reception process that we manage, that we can, and if you want to tell me where that is, and we can work with that
So
to get us started.
General Milley did it when he was at 10th Mountain Division, and it was kind of carried on, and it was like an epiphany that he said that he had where all the agencies, and having sat on a number of suicide boards and SHARP boards, we'd come back to the end of it saying, if I only knew that this soldier was having trouble like everybody else, but this soldier had more trouble because I didn't know that he had this incident 6 months ago in his previous unit. And that's where this report kind of came out. And then, again, it was great, and it would just break it down into 4 or 5 categories. But, again, it has to be staffed. ASAP's got to have a piece of it. The legal side had a piece of it. So we knew if they had some sort of special case that we didn't know about, because not everything is flagged, not everything follows the soldier. And if you can at least see that. And I don't think it's something that you can just turn a switch on. It takes a little bit of, and I know you got the risk reduction, or the risk dashboard. That might be the solution that they came up with. But in the interim, I asked my battalion commanders, hey, how are things going? And they're looking at me going, I don't have a report, and I didn't know that this guy was having problems.
The Army, the initiative was with the Army 2 years ago to do exactly what you're saying. I'm not sure if Fort Hood does it anymore. I was told, I don't know if Fort Drum's still doing it. HIPAA has started to prevent some of that sharing of data because we're sensitive to that. So the Army was working to how they would do just what you said. So if you're getting a soldier, that packet would come and say, it wouldn't tell you all the trail of tears of that soldier, but it would say this soldier's got potential high risk for this. I got to go back and find out what the Army has done, but that was briefed to the Chief of Staff of the Army before I came to First Corps.
Sir, I believe it's the Commander's Risk Reduction Dashboard and they are still working on that, and we went through the pilot for the increment 2 for that, and it is still in its infancy stage.
Well, and I've asked, and who owned the Commander's Risk Reduction Dashboard? Who owned it?
DA.
Yeah, who in DA?
ARD.
ARD?
Yes, sir.
Okay, let's call them.
Cool.
Because I know the Provost Marshal General of the Army was also working it before he became the IG. Because it's a function, it's not just that piece, it had the criminology, and he was beating it and told me for the 2 years I was the Chief of Public Affairs before I ever got to the division I went to, it would be out. And I'm now at First Corps and it's still not out. So the question becomes, what is currently out there that we could adopt? Because I think your question's a good one. And I'm not aware of, that was what I thought the be-all end-all for the Army was going to be. So if it's still not out, then...
No, it's out, sir. It's out. It's just not a perfect system, but it's out. Our battalion commanders and our company commanders are all
Well, you said we
required to
did
be
a
enrolled.
pilot on it.
No, sir, we did it they did an increment 2 to improve the system, and JBLM did the pilot for that.
Okay.
To
Yeah.
offer feedback back to the
Okay.
contractor.
Go ahead.
I used to be on the R2C team, and I did the pilot for the risk reduction dashboard. And actually what they did was they found we had to pull all of the commanders, because commanders are the only ones who have access to it. And one of the instances they found was that they could get their own data so much faster by reaching out to ASAP, reaching out to finance, reaching out to the blotter. Because by the time that the dashboard actually got all the information collaborated together, and then they got their screenshot, and it said everything for each soldier, it was too late. They already had the data from different reports that they were receiving. And the pilot that we did for increment 2 was in order to get the feedback from all the commanders and say, why isn't this working? And I believe it just ended at the beginning of FY17 was when the pilot ended.
Okay, we owe you an answer. We owe you an answer. Here's what I worry, and this is why I asked the question I did before. What level of leadership do we need to focus on? And we talk about command teams. But, you know, what bothers me about the Army is, you know, we push capability down, all the way down to the only command team that doesn't have a staff. And we require all of this information from that company commander that's got him, his first sergeant, an XO, and a training room NCO. But yet they've got all of this stuff to do. So if we say that, you know, the commander has to go out and personally pull this piece, we're asking that company commander who doesn't have a staff to do what battalion and brigades and divisions should be doing. This is my argument to General Abrams when we talked about all of these tools, DTMS. I said, why are we making company commanders do that? Why don't we let company commanders go back and do what we did back in the day? They'd submit it to their battalion, let the battalion staff fill out DTMS because they've got a staff. Make the brigades do this. We've inundated our company commanders, and then we yell at them because they're centered around a computer instead of out with their soldiers. So what I want to do is figure out if the solution is Captain Valesky calls out to all of these own entities to get information on the 150 soldiers that's in his company. That's problematic if that's what our solution is, and I'm not sure what it is. So I don't want to.
That's not the solution, sir. The commander's risk reduction.
Hold on. I'm not done talking. So I want you to send out to everybody here what
what right looks like and what the current solution is, and then we can have some feedback doing that, okay? I don't want to get into a discussion. Let's get out what we think. Let's get shared understanding and a common operating picture on what is out there to the commanders, and then let's get their feedback to say, yeah, but, or no, we don't have a problem. This is okay. Does that make sense? Does that make sense, Tammy?
Yes, sir.
Okay. All right. That scratch your itch a little bit, Chris? Okay. I just said we were going to stop at 14:30 to talk. I didn't say I was letting you out of here early. So if you're going, if we don't ask, we're out of here 20 minutes earlier. That might not be the case. Send it, Mike.
I appreciate the tab card. I'm just curious, is anybody aware of any either reduced price or free rides for soldiers who are or airmen that are downtown that found themselves in a position either they had too much to drink or the people they were with have too much to drink? If so, can we get that out to folks?
Yes, the BOSS program has a anti-DUI program where we'll come out within 15 miles, pick you up, bring you to the unit, and take care of you that way. I'll get that out to everybody.
Anything else? Anybody else back there? Any other questions, commanders? Anybody from the group that's in the upper deck seats out there? The people that do all the work, that are taking the notes going, there we go. Anybody over there? Yeah. Well, I'm coming around the table. No problem. Any save rounds? Doc, any save rounds?
Sure. Well, I think we do have a couple of resources out there that we've talked about in the past with our intensive case management and our combined risk reduction program. So I think people may be a little bit shy. I was doing body language, trying to get people to stand up and talk in relation to Chris's question. But I think there's more to be talked about on that. We just need to with the transitions, fill people in on what's going on. And then while I have the mic, when you're talking about the top 4 list, et cetera, absolutely acknowledge that if you're looking at numbers, musculoskeletal injuries and things are going to have the biggest impact on readiness. But I think we need to approach this from a prevalence versus severity kind of risk management framework, because there are some things where the numbers aren't large, but the consequences are much more severe. So just keep that in mind as we're looking at that top 4 lists. Sir, over.
Mike, anything on the back side?
So I just have a question about, are there any interactive...
Thank you. Are there any interactive applications in process that soldiers can download on their phones or maybe tie into their Fitbit or anything like that that could actually maybe even measure like how much they're drinking? Because sometimes we don't even realize what we're doing until someone points it out or something along those lines.
T2.
T2?
If you don't know what T2 is, it's a DoD medical team that develops apps for soldiers, sailors, airmen, Marines. So if you want an app for it, I got a team that does that. And they're stationed here for all of DoD. So, yes.
Roger, thank you.
If they don't have one immediately, they'll make one for you. Yeah. Even better.
Go ahead.
Sergeant Major Hellring. I have the T2 team come to the academy, and they talk to the BLC soldiers, and they show those soldiers how to download those apps. So the soldiers, the sergeants, the new sergeants are getting that information.
Okay. Anything else?
That's it, sir. Thank you.
Turn it over.
Thank you, sir. Just a reminder for all the commanders and sergeant majors, you may or may not be aware of it. Each of your religious support teams actually have a dashboard, and so I'm training them to do analysis of all the counseling they're doing, and so they're quantifying it by spiritual, by high risk reduction, etc. And then they're supposed to look at that and be talking to you about the types of counseling they're doing in your units, then comparing that to the training that they're doing for you. So as you're determining what your top issues are that you want to get after, I would ask that you would pull your chaplain teams in there and ask them to show you that dashboard, because it looks the same for all of us. And then I actually report all those numbers to General Valesky every 2 weeks, so he's actually aware of what our counseling trends are. And then just a reminder, we briefed the HOPE scale a few months ago, and we've had over 3,000 soldiers use that HOPE scale, and it's actually helping us identify levels of well-being. It's 20 years of research, 95% effective, 12 questions. So we're using those in spiritual fitness events, et cetera, SRPs, and that's a really quick method of looking at a platoon or a company or something like that and seeing where they're at. Thank you, sir.
Sir, just one comment real quick. Sir, earlier you asked the question, who do we really target and focus the education on? And there was a lot of great initiatives that are taking place throughout JBLM, but I have always thought and always will think that it really boils down to the Sergeant E5. Our sergeants do three things. They train, they inspect, and then they lead by outstanding personal example. They are what makes our Army run, but they are also that same population of 18 to 25-year-old soldiers. So it requires a lot of constant education. It requires oversight. But I think if we really focus in on those young leaders, soldiers want to be inspired by a good young sergeant. And 95% of them are great Americans, but there's a population that's mediocre at best. And those soldiers that might be mediocre at best are going to follow. They're going to follow somebody, and we want them following the right NCOs and officers, et cetera. So, and then last thing, sir, just for the group that many of you may know and you may not, but General Burleson is no stranger to Joint Base Lewis McChord, and we are excited to have him as our commander effective tomorrow at 1000 hours.
This is the first one of these that I've been to, and I wanted to say just thanks for the inclusion in the community here at JBLM, for the Air Force members here. And, a lot of the discussion, I hear soldiers and Army, and we are a much smaller entity here. And the one thing I'm very appreciative of the Army in that is that you do bring mass, and the programs that I see are impressive. And so there's a lot that we can learn from and bring to the table on the Air Force side in this. So to see this crosstalk and how open everybody is being in this forum, coming in as a new commander here and representing the Air Force, I'm very appreciative of that. And hopefully, what you see from us, and we brief a program like ADAPT, is that one incident has a profound effect on our mission. And an example of that was, and not to get into too much detail, but we had a series of suicides in the winter into early spring, and we actually had to take down our PNAF squadron, so our prime nuclear airlift force. That mission set had to come off the table for a small amount of time while that squadron regenerated internally. So these programs matter to us a lot because the mission impact is instantaneous. So we don't have a lot of mass, but it's important. So we appreciate the cross-talk and the resources and helping us keep on point. Thanks for the opportunity, sir.
I want to thank everybody for participating. What I would say is, when they told me back in the day, when you take command, you command 3 organizations. The one you take, the one you train, and the one you transition and turn over. Well, I think I'm commanded about 5 different organizations the first 4 months of command. If you look around the table, there's a lot of folks here. We're going to officially welcome Jeff Milhorn, our new DCG, Mario, our new chiefs here, General St. Louis, our new DCG. There are a lot of new faces around the installation. As you heard, Reba and Nicole, they're both pretty new. I would just say don't take for granted that everybody around here knows what we're talking about. So some of you old timers, and an old timer could be someone that's here 4 months. I mean, The lessons that you've learned, please don't make one of your peers go through discovery learning and then you all go, as we hear, well, heck, if I'd have just known that, you know? Well, I went through that like 2 months ago if you'd have done this. So that'd have been helpful, 10 minutes before I got that call that something bad had happened. So I'd ask you to continue to dialogue amongst yourselves. I want to also highlight, Sergeant Major Love is always deflects it, but if you didn't know, he's been selected to go to Afghanistan, be a sergeant major out there, and he's leaving like tomorrow. So if you didn't know that, I want you to not let him leave the room without thanking him for the phenomenal work he's done, and not just the 7th Infantry Division, but all across JBLM is a great example of what right looks like. And so, Sergeant Major, it's been an honor serving with you. I'm going to tear up tomorrow seeing you hand that guide on to Brother James and know that you're going to be following him out the door. But thanks for all you've done and all you continue to do for our nation. Have a great day. JBLM.